Assalamu alaikum, welcome to Pediatric Case Review. Today we will discuss the clinical manifestations and the diagnosis of systemic lupus erythematosus among pediatric patients. Let's begin. We will start with clinical case scenario. Then we will continue with questions and answers. So our case today, a 14-year-old Hispanic female presented to the pediatric clinic with a 3-month history of persistent low-grade fever. Also, she has unexplained weight loss and increasing fatigue. She also reported experiencing joint pains, particularly in her wrists and knees, which were more pronounced in the morning. Over the last month, she developed a noticeable rash on her cheeks and nose, which worsened with sun exposure. No significant past medical or surgical history, and no allergies and immunizations are up to date. Regarding family history, her mother has rheumatoid arthritis. Upon doing vital examinations, she has normal vital signs, temperature, heart rate, blood pressure, but general appearance shows she is tired with noticeable weight loss. Skin shows rash across the cheeks and the bridge of the nose, sparing the nasolabial fold. Musculoskeletal examination shows tender, swollen joints in both wrists and knees. Other examinations are normal. Lab investigation shows mild anemia, lymphopenia in CBC, proteinuria and hematuria in urine analysis, positive ANA and anti-double-stranded DNA antibodies, also low 3 and C4 levels. So our assessment in this patient, the clinical presentation along with lab findings is highly suggestive of a childhood onset systemic lupus erythematosus. The symptoms of persistent fever, weight loss, fatigue, arthritis, characteristic malar rash, and lab findings align with classic presentation of systemic lupus. Question number 1. What mucocutaneous manifestation is characteristic of a childhood onset systemic lupus erythematosus? A. Pustular rash. B. Malar rash. C. Psoriatic plaques. D. Fetal-like. The correct answer is B. The malar rash or butterfly rash is a classic mucocutaneous manifestation of systemic lupus. It typically presents as flat or raised erythematous rash over the cheeks and nasal bridge, sparing the nasolabial folds. This feature present in the case scenario is highly indicative of systemic lupus. Also, it is often exacerbated by ultraviolet light exposure. Question number 2. Which systemic symptom is commonly observed in childhood onset systemic lupus? A. High-grade fever. B. Hypertension. C. Persistent low-grade fever. D. Hypoglycemia. The correct answer is C. So systemic symptoms in systemic lupus is often include persistent low-grade fever, also fatigue and weight loss. The low-grade fever is typically a sign of systemic inflammation and is not necessarily associated with infection. Question number 3. What is a common musculoskeletal symptom in a childhood onset systemic lupus? A. Osteoporosis. B. Arthritis and arthralgia. C. Myopathy. D. Bone fracture. The correct answer is B. Arthritis and arthralgia are frequently seen in childhood systemic lupus and often involve multiple joints. The arthritis in systemic lupus is typically non-erosive and can cause joint pain, swelling, and burning stiffness. And non-erosive means it will not lead to joint destruction as seen in rheumatoid arthritis. Question number 4. Which indicator is most relevant in identifying renal involvement in childhood onset systemic lupus? A. Hypertension. B. Proteinuria and hematuria. C. Increased urination frequency. D. Flank pain. The correct answer is B. So renal involvement, known as lupus nephritis, is a serious complication, and the early indicators include proteinuria and hematuria. These findings suggest kidney damage or inflammation, often requiring further investigation like renal biopsy for definitive diagnosis. Question number 5. Which hematological abnormality is commonly seen in systemic lupus? A. Anemia and lymphopenia. B. Elevated white blood cell count. C. Thrombocytosis. D. Polycythemia. The correct answer is A. Hematologic abnormalities in systemic lupus often include anemia and lymphopenia. These conditions reflect the systemic nature of the disease and its impact on the bone marrow. Anemia can be due to chronic disease or hemolysis, and lymphopenia may be the result of immune dysregulation. Question number 6. What is a common neuropsychiatric manifestation in systemic lupus? A. Frequent seizures. B. Severe depression. C. Headaches. D. Cognitive dysfunction. The correct answer is C. Neuropsychiatric symptoms in systemic lupus are diverse, but headaches are particularly common, and this may range from mild to severe migraines. The other neuropsychiatric manifestations less commonly occur, like cognitive impairment, mood disorders, and in more severe cases, seizures and psychosis. Question number 7. What is a frequent pulmonary symptom in childhood systemic onset systemic lupus erythematosus? A. Asthma. B. Pleuritis. C. Chronic obstructive pulmonary disease. D. Pulmonary fibrosis. The correct answer is B. Pleuritis, which is inflammation of the lining of the lungs, is a common pulmonary manifestation in childhood systemic lupus. Patients may experience chest pain, especially when breathing deeply, while other lung conditions can occur in systemic lupus, but pleuritis is the most frequent in this condition. Question number 8. What factor is strongly associated with thromboembolic complications in childhood systemic lupus? A. Obesity. B. Dehydration. C. Sedentary lifestyle. D. Lupus anticoagulant presence. The correct answer is D. The presence of antiphospholipid antibodies, including the lupus anticoagulant, is a significant risk factor for thromboembolic events in systemic lupus. These antibodies can lead to an increased risk of blood clots in veins and arteries, resulting in complications like deep vein thrombosis or stroke. Question number 9. Which cardiac issue is most commonly seen in children with systemic lupus? A. Myocardial infarction. B. Congenital heart disease. C. Pericarditis. D. Cardiomyopathy. The correct answer is C. Pericarditis, or inflammation of the pericardium, is a common cardiac manifestation in childhood systemic lupus, and symptoms include chest pain, palpitations, and shortness of breath. And pericarditis can be detected through clinical examination and also ECG findings and echo. Question 10. What gastrointestinal issue is observed in a childhood systemic lupus? A. Gastroesophageal reflux disease. B. Peptic ulcer disease. C. Pancreatitis. D. Chronic diarrhea. The correct answer is C. Pancreatitis, or inflammation of the pancreas, can occur in systemic lupus and usually presents with abdominal pain, nausea, and vomiting. It is a serious complication and can have increased morbidity. Question 11. What lab finding is critical for childhood systemic lupus erythematosus diagnosis? A. Elevated liver enzymes. B. Positive ANA and anti-double-stranded DNA antibodies. C. High serum creatinine. D. Hyperglycemia. The correct answer is B. Positive ANA and anti-double-stranded DNA antibodies are key lab findings for diagnosing systemic lupus erythematosus. While ANA is a sensitive marker, the anti-double-stranded DNA is more specific to systemic lupus, and these antibodies indicate autoimmune process and are important for the diagnosis and monitoring the disease activity. Question 12. What is crucial for diagnosis a childhood systemic lupus erythematosus? A. Clinical judgment and exclusion of alternative diagnoses. B. Genetic testing. C. Family history of lupus. D. Response to steroid therapy. The correct answer is A. So diagnosing childhood systemic lupus involves clinical judgment, taking into account the patient's symptoms, lab findings, and exclusion of other possible causes. It is a diagnosis of exclusion and often requires a thorough assessment to differentiate it from other similar conditions. Question 13. What is essential in diagnostic approach for a childhood systemic lupus erythematosus? A. Long-term symptom observation. B. Genetic testing. C. Immediate organ biopsy. D. Comprehensive blood tests including CBC and urine analysis. The correct answer is D. The initial diagnostic approach for childhood systemic lupus includes comprehensive blood tests like a complete blood count and urine analysis. These tests help to identify common abnormalities such as anemia, lymphopenia, proteinuria, and hematuria, guiding further specific investigations like autoantibody testing. Question 14. When should a patient with suspected childhood onset systemic lupus be referred to a pediatric rheumatologist? A. Only after a complete response to initial treatment. B. After a year of persistent systemic lupus. C. As soon as a childhood systemic lupus is suspected, especially in hospitalized patients. D. Once all non-specialist treatments have been exhausted. The correct answer is C. So early and prompt referral to pediatric rheumatologist is crucial in cases of suspected systemic lupus. The complexity of the disease and its multi-system involvement and the need for specialized care and treatment plans necessitate expert evaluation. A pediatric rheumatologist can provide comprehensive care that address both the physical and psychological aspects of the disease, ensuring appropriate disease management and monitoring for complications. And the delay in specialist consultation might lead to disease progression and increased risk of irreversible organ damage. Question 15. Which set of criteria is used for classifying childhood onset systemic lupus erythematosus for clinical and research purposes? A. DSM-5 criteria, B. WHO criteria, C. American College of Rheumatology or ACR criteria, D. CDC growth charts. The correct answer is C. The ACR criteria are widely used for classification of systemic lupus both in children and adults. These criteria encompasses a range of clinical and immunological manifestations commonly observed in systemic lupus. While originally developed for research purposes, they are often used in clinical practice to aid in diagnosis. The criteria include typical manifestations like malar rash, serositis, renal disorders, neurological disorders, hematological disorders, immunological disorders, and positive anti-nuclear antibody tests. So they provide a standardized approach to diagnose systemic lupus, helping to differentiate it from other rheumatic and autoimmune conditions. Question 16. In the differential diagnosis of a childhood onset systemic lupus, what other conditions should be considered? A. Infectious diseases and other autoimmune disorders. B. Psychological disorders. C. Nutritional deficiencies. D. Orthopedic conditions. The correct answer is A. So the differential diagnosis of a childhood onset systemic lupus is broad due to its varied clinical manifestation. It has a very wide range of manifestation. It is essential to consider infectious diseases, as certain infections can mimic or trigger autoimmune responses similar to those seen in systemic lupus. Additionally, other autoimmune disorders such as juvenile idiopathic arthritis, mixed connective tissue disease, and vasculitis can present with similar symptoms and lab findings. So the presence of overlapping symptoms and lab abnormalities with these conditions make it challenging to diagnose systemic lupus. Therefore, thorough evaluation, including detailed history, physical examination, and appropriate lab testing is vital to differentiate systemic lupus from other conditions. Thank you for joining us. Stay tuned for more pediatric case reviews.